Conventional medicine is failing millions of Americans with autoimmune conditions, offering them treatments that often cause as many problems as they solve. For decades, the standard approach to autoimmune diseases has been powerful immunosuppressant drugs and biologics that can cost tens of thousands of dollars annually and come with serious side effects, while a simple, low-cost alternative has been hiding in plain sight. If you or someone you love is struggling with an autoimmune condition, every day spent on ineffective treatments means more pain, more inflammation, and more damage to your body, not to mention the financial burden of expensive medications that may not even be working. Stay with me until the end, and I'll share the specific questions you need to ask your doctor to determine if this alternative treatment could be right for you. Questions that can completely change your approach to managing your condition. Hi, I'm Mark Filosi, a compounding pharmacist with over 35 years of experience helping patients find solutions that conventional medicine often overlooks. Today, I want to talk about a medication that's been transforming lives but remains unknown to most people with autoimmune conditions. If you're one of the millions of Americans living with conditions like Crohn's disease, fibromyalgia, lupus, Hashimoto's thyroiditis, or any other autoimmune disorder, or if you're watching this because you care about someone who does, this information could be life-changing. In the next few minutes, I'll explain how a medication called Low Dose Naltrexone, or LDN, is helping people with various autoimmune conditions achieve relief when nothing else has worked. I'll share the real scientific evidence behind it, explain how it's different from conventional treatments, and tell you exactly what to expect if you decide to try it. A clinical study published in Digestive Diseases and Sciences found that 88% of Crohn's disease patients treated with low-dose naltrexone experienced significant clinical improvement, and 78% showed actual healing of intestinal inflammation, results that rivaled or exceeded many conventional treatments, costing 100 times more. Low-dose naltrexone is not a new drug. It's a new application of an existing medication. At standard doses of 50 milligrams, naltrexone is FDA approved for treating addiction. But at much lower doses, typically 1.5 to 4.5 milligrams, it appears to help regulate the immune system through a completely different mechanism. Unlike immunosuppressants that broadly disable parts of your immune system, LDN works differently. It temporarily blocks certain receptors which cause your body to increase the production of endorphins and enkephalins, your body's natural regulators of immune function. This may help restore balance to an overactive immune system without shutting it down completely. The conditions that have shown the most promising responses to LDN include Crohn's disease and ulcerative colitis, fibromyalgia, multiple sclerosis, Hashimoto's thyroiditis, lupus, rheumatoid arthritis, psoriasis and other autoimmune skin conditions, and many other inflammatory conditions. What's particularly remarkable is that some patients who fail to respond to conventional treatments, including powerful biologics, have found relief with this simple, low-cost option. Let's talk about the real evidence. While LDN doesn't have billion-dollar pharmaceutical funding behind it that newer biologics do, there's a growing body of clinical research showing its effectiveness. In one double-blind, placebo-controlled study of Crohn's disease patients, 88% of those receiving LDN achieved a significant clinical response, compared to just 40% on placebo. Even more impressive, 78% showed actual healing of intestinal inflammation on endoscopy. None of the placebo patients showed this improvement. Similar studies in fibromyalgia have shown significant improvement in pain scores, fatigue, and sleep quality. And numerous case studies across various autoimmune conditions consistently show that about 60 to 70% of patients experience meaningful improvement. But what does this actually look like for patients? Most describe a gradual improvement rather than an overnight miracle. Typically, patients notice small changes within the first 2 to 4 weeks, perhaps sleeping better, or having slightly more energy. By 8 to 12 weeks, the full benefit often emerge. Reduced pain, improved energy, decreased inflammation, and better overall function. One of my patients, Sarah, had suffered from Crohn's disease for over a decade. Despite trying 3 different biologics, she still experienced frequent flares and couldn't live a normal life. Within 3 months of starting LDN, her symptoms had improved so dramatically that she was able to travel again, eat food she hadn't enjoyed in years, and even reduce some of the other medications. If you're interested in trying LDN, here's what you need to know about the process. First, LDN requires a prescription, and it needs to be prepared by a compounding pharmacy. That's because the commercial version of naltrexone only comes in 50 milligram tablets, about 10 times higher than the dose used for autoimmune conditions. Most doctors start patients at a low dose, typically 1.5 milligrams, taken once daily at bedtime. The dose is then gradually increased over several weeks until reaching the optimal level, usually between 3 and 4.5 milligrams. Some patients find their sweet spot is actually lower, around 2 or 3 milligrams, which is why proper titration is important. Side effects are generally minimal compared to conventional treatments. The most common are vivid dreams or sleep disturbances within the first 2 weeks, and occasionally mild headaches. These typically resolve quickly as your body adjusts. As for what to expect in terms of results, patience is the key. Unlike steroids or pain medications that mask symptoms immediately, LDN works by gradually helping your body restore normal immune function. Most patients see initial improvement within 2 to 4 weeks, but the full benefit often takes 2 to 3 months to develop. It's also important to know that LDN is typically very affordable, costing only $100 a month. Though insurance coverage varies because it's prescribed off-label for autoimmune conditions. We've created a free LDN information kit that includes a physician's discussion guide with exact questions to ask to your doctor, a symptom tracking journal to monitor your progress if you decide to try LDN, and a list of compounding pharmacies experienced with proper LDN preparation. Visit familycarepharmacy.org/LDN kit or click the link in the description to download it now. As promised, here are the specific questions you should ask your doctor about LDN. 1. Given my specific autoimmune condition and symptoms, could low-dose naltrexone be an appropriate treatment option for me? 2. What potential interactions might LDN have with my current medications? Note, the only major interaction is opioid pain medications, as LDN can block their effect. Or 3. Do you have experience prescribing LDN, and if not, would you be willing to learn more about it or refer me to someone who has experience with it? 4. If we decide to try LDN, what protocol would you recommend for a starting dose and titration? 5. Which compounding pharmacy would you recommend for preparing my prescription? Taking these questions to your next appointment can start a productive conversation about whether LDN might be right for you. If you're struggling with an autoimmune condition and haven't found the relief you need, don't wait to explore this option. Download our free LDN information kit at familycarepharmacy.org/LDN kit. Share this videos with others who might benefit and schedule an appointment with your healthcare provider or contact us at Family Care Pharmacy to discuss whether LDN could be right for you. Imagine what it would feel like to finally have your autoimmune condition under control, not through powerful drugs that suppress your entire immune system, but rather through a gentle approach that helps your body heal itself. For many patients, LDN has made this transformation possible. Let's quickly recap what we've covered. 1. Low-dose naltrexone is a low-cost, low-risk treatment option that can help regulate immune function in many autoimmune conditions. 2. Clinical studies show impressive response rates, with 60 to 80% of patients experiencing meaningful improvement in various conditions. 3. The process of starting LDN is straightforward, but requires working with a knowledgeable healthcare provider and a proper compounding pharmacy. Have you or someone you know tried LDN for an autoimmune condition? Share your experience in the comments below, or let us know which questions you have about this treatment option. Thanks for joining us today. Subscribe for more friendly tips to keep you on track and feeling your best. And don't miss the next video. We picked one we think you'll really enjoy.